And as promised, back with Dr. Tim McKnight this morning. And Dr. McKnight, good morning, first of all. And
Good morning.
We've been talking about some things that are kind of prevalent during this time of the season, I guess, with bacterial infections and viral infections. And now we get to talk about the flu.
Yes, influenza. And this is what people worry about this time of the year. It usually starts late September, early October, and it goes through about March or April. And so a lot of people will be afflicted by this. And some years the flu is really rampant, and there's a lot of people that get sick.
Yeah.
And there's always a certain percentage of the population that's going to die from it. But I think a lot of people probably have a fear that's over excessive. They probably don't need to worry about dying from the flu. However, there are certain people that are always going to be at risk, as with most infectious diseases, right? We say people that are diabetic, people with heart disease. Well, what does the heart and what does sugar have to do with an infection? It's really not the diabetes or the heart, the blockages in the coronary arteries. It's the inflammatory state that these people have. And with that inflammation, they're more susceptible to an overproduction of inflammation and a worsening of the disease when they're infected by these viruses. And then there are people with asthma and emphysema, and the reason that they're at risk is not so much the inflammatory issue as it is the lung issue, because influenza is a respiratory virus. It infects the nose, the throat, and the lungs. And if those tissues aren't healthy, then they can suffer, and you have a harder time breathing. And so sometimes people, when they develop influenza, they have breathing complications, have to be in the hospital, sometimes even put on a ventilator. So those are the people at risk. If you're relatively healthy, you get the flu, you're going to feel miserable for 3 to 5 days, pretty awful, and then you recover. So that's probably the first thing I think people should understand with the flu.
Is it more prevalent in the colder weather for us, at least?
I'm not sure I've ever really heard a clear explanation for that. It may be, since these viruses are respiratory spread, so you cough or sneeze into a person's face or on an object, it can be transmitted that way. And perhaps but we tend to be more indoors this time of the year, and we're in closer. You can be in an elevator and somebody coughs or sneezes, and you're right there. So that's probably it. I don't think it has to do with the cold weather so much. Mom says, put your jacket on, you're going to get a cold. I'm not sure there's much logic to that, but that's what we all believe. But yeah, it's probably the close quarters and the fact that these viruses get in the respiratory tract. And It's interesting because when you cough or sneeze on stainless steel, those viruses actually live longer in stainless steel and hard surfaces. A doorknob, you cough in your hand, and then you've got the virus on your hand, and you open a door, and that stainless steel door knob is going to hold the virus longer. But soft objects and furniture, it really doesn't stay very long. There's a lot of other variables. It's the temperature of the room, it's the humidity, and how much virus you actually are coughing into somebody. Sometimes you're just developing the virus. There's not a lot in you, or you're at the tail end of it and there's not a lot there. But if you're in the midst of it and you're really sick, that's when the viral load is really high and you're more likely to infect somebody else. So, that's why we say wash your hands, and it's not a quick, put your hands under the water and rub them together 3 times and dry your hands off. It's use soap and water and wash for 20 or 30 seconds and really get that off. We say cover your mouth when you cough or sneeze, and rather than put it in your hands, put your arm over your face and cough into your arm or something like that. Or
because you're not shaking elbows with people later.
Yeah, you should. I can't imagine you do that, but yeah, that's right. So you're putting the virus in place where you're probably not going to contaminate somebody else.
Now, you talk about influenza. I mean, there's a lot of different variations. Can we treat most of those basically the same, though?
Yeah, it's pretty interesting. There's a whole family of viruses in the influenza family. There's influenza A, influenza B, and influenza C. And the ones we usually see this time of the year are A and then some B. And we can test those. And we can do a rapid test where we take a little swab and we swab the inside of your nose. We get results back quickly from that. The problem with that test is the specificity is good, meaning if you aren't infected, it will usually say it's a negative result. But the sensitivity is not the greatest in these. So if you have the flu, it may test negative. So it's a false negative. So we call that sensitivity. So people have to understand that it's not a perfect test. The gold standard is a viral culture, where we take a sample from your nose, your respiratory tract, and we culture it. But that takes 3 to 7 days. And by the time we get the results back, you're probably feeling better, or you're in the hospital and you're worse. So that's why we do the rapid testing.
Yeah, that makes sense.
But I think most people, I see a lot of people in the office this time of year thinking they've got the flu. Well, they've got a cold, or they've got a gastrointestinal bug. So influenza is not usually vomiting, diarrhea, and stomach bloating. That's it. That's a intestinal flu. Influenza flus tend to have fever, chills, headache, and a body that feels like it's been hit by a truck. And then you can have some coughing and runny nose, but some of those overlap into just a bad cold. But fever, chills, just exhausted, headache, and feeling like you've been hit by a truck, everything hurts, and you don't want to get out of bed for 3 to 4 days, 5 days. That's probably influenza, and often we'll treat it based on those symptoms, and sometimes we like that rapid test to confirm it. But even that, like I said, that test is not always confirmational. It doesn't always prove that that's what it is.
So you get a fever with influenza. At what point or around where do you get concerned with the fever being too high, so to speak?
Well, my daughter asked me this last night about one of her 3-year-old daughter who had a fever and was coughing, and it's a hard question to answer. We want a number, and you can't always give a number, a temperature. So anything higher than 105 is definitely too high, and you need to be seen. You need to be cooled down. So, but I want people to understand that when you get a fever, that's actually your body helping you. So that increased temperature makes the viruses and bacteria a little bit more vulnerable to being overheated and not being able to survive. So it's a kind of a self-defense mechanism. But of course, the fever makes you feel awful, and if it gets too high, it can be dangerous. So I can't really give you a number. What I can say is, if you've been around somebody that's had the flu and you start to have flu-like symptoms, don't wait 3 or 4 days. Get in right away, because if we can diagnose it in the first 48 hours, then we can give you an antiviral treatment that will shorten your course and make you feel not so miserable. But if you've waited the 3rd day, those medications, they're only a 5-day medication, and they're probably not going to help you much. So that's the mistake most people make with the flu, is they wait too long to be diagnosed. We'll often give it just because we want to try to do something, but it really is more effective when you get it right at the onset.
Is there anything over the counter that's effective to at least reduce the symptoms?
Yeah, you can take Tylenol. If you've got a cold or a cough, you can take Tylenol, cold and cough, or any of those agents to help control the symptoms. And if you have high blood pressure, you probably ought to talk to the pharmacist or your provider, because some of those cold medicines can make your blood pressure go up. If you're a man with prostate issues and you can't empty your bladder well, some of those cold medicines will make that more difficult. So those are worthy of a conversation with the pharmacist or your provider to make sure you're making the right choice. But we always tell people to get plenty of rest. And really, this time of year, we should be boosting our immune system. So lots of rest. One of the things that's really good, we always talk about exercise, but exercise is important here, because you want your lungs to be healthy. You want them to be able to expand. When you've got mucus and inflammation in your lungs because you've got the flu, the last thing you want are weak lungs. Yeah. And that sort of goes back to what happened with the Delta variant in COVID last year. It was not the same family of virus, but it did the same kind of thing as influenza can do. If you have underlying inflammation and now you've got mucus and inflammation and swelling in your upper and lower respiratory tract, if you can't breathe well when that mucus comes, you're going to work really hard to breathe. And that's what happened with COVID-19, especially the Delta variant. These people were working so hard to breathe that their respiratory muscles were tiring out, and that's when we had to put them on ventilators and breathing machines and do that for them. And that's a pretty advanced stage, and the mortality rate was over 50% with COVID when that happened. And I would imagine it's the same with influenza. But like I said, most people don't die from it. My grandmother died of influenza, and she had rheumatoid arthritis. She was immunosuppressed, And when the virus went around the family, she was visiting her daughter and her family in Florida. Everybody got the flu and got over it, but Grandma didn't. And that's the inflamed state. That's the older age. She was 78. And those are the people that we have to be careful with.
Other than the elderly, what's the difference between adults and children, let's say, elementary age kids with the flu? Is there any different treatment or thing to expect?
No, the treatments are about the same. And the flu vaccine, the CDC believes is protective. And so CDC recommends that you get the vaccine sometime in September, so you have a couple weeks before it really works to help to protect you. And the idea behind the vaccine is that we're trying to prevent the virus from attaching to your respiratory tract. And some years those vaccines work better than others. Mm-hmm. And the concept is that influenza is a real simple virus. It's basically got a protein capsule on the outside and then the RNA that replicates on the inside. And so there's probably 20 different proteins on the outside of this protein capsule that surround the virus. And those different proteins are what attach to the respiratory tract. And once they attach, then the DNA or the RNA of the virus gets injected into a cell, the human cell, and then it takes over the human cell's ability to replicate. It starts using the human cell's replication enzymes, and it starts replicating this virus. And now you get millions of viruses in a cell, and basically the cell just explodes because there's so much, and the cell dies, and then it goes to the next and the next. So the vaccines are designed to help block those proteins on the coat of the virus from attaching to respiratory cells. So it gets in, but it never really attaches well enough. And every year there's a mutation in these viruses. Mm-hmm. They mutate just like anything in nature, and it's due to pressures, genetic pressures. So it will mutate to survive. So the virus, the vaccine we have now has two. I'm trying to think of the word. Two proteins that block influenza A, and at least two proteins that block the attachment for influenza B. But that's based on, which one of those proteins were really prevalent? Which one of those were attaching last year? And we look at that, and scientists, there's 10 virus types that affected people in 2021. What were the four most prevalent? Mm-hmm. It was these 4 proteins. So let's make a vaccine that blocks those 4 proteins. That works great, except in a year's time, that virus is going to mutate. And if it's a big mutation, then the vaccine isn't effective. And that's what we had in 2009. I think it was 2009 when we had the H1N1. Mm-hmm. And in 2018, the Spanish flu, that was another year where there's a huge shift in the genetics of these viruses, so they could attach and cause a lot of disease. So those are the pandemics, and we've had about 4 of those significant pandemics in the last 100 years that have caused a lot of disease, a lot of death worldwide, because the virus outsmarted our immune system. And that's why sometimes these vaccines don't work as well as we want them to. And some people are concerned about the safety of vaccines. That's a completely different issue. I really believe the immune system, if it's healthy and you're healthy, is a pretty good way to protect yourself. And we've talked about food, we talked about good rest, exercise, all those lifestyle things. Smokers are going to be at more at risk because they can't clear their lungs. And again, those that have a lot of inflammation are more at risk. So it's just one of those things where you try to do the best you can and stay healthy. Try to prevent the spread. Try to prevent having the virus attack you. And if it does, go see your provider. We have Tamiflu and some other antivirals. There's a nasal spray that some groups of people can use to help fight this off. But it's prevalent. I think we just need to be smart. We need to use good hygiene and get help when we're to that point where we need it.
No question. Dr. McKnight, thanks. Make sure to wear your coat on the way out.
Okay. There you go. Thanks.
That's our talk with the doc this morning.